PureAir 8 is suitable for patients up to a maximum weight of 222 kilograms. There is no minimum patient weight limit. The CPR dial is located at the foot end of the mattress. Rotate the dial to the open position and the entire system will rapidly deflate. The audible and visual alert is activated if the pressure becomes too low, there is a power failure or alternation fails. If static mode is selected, it will auto-return to alternating mode after 30 minutes for patient safety. To adjust the pressure, use the up and down arrow keys. Green indicators will show which pressure is selected. To change between cycle times, press the clock button. Green indicator will illuminate to show whether 10 minutes or 15 minutes is selected. The control unit automatically locks for 2 minutes after a function change. To unlock, press the lock button for 2 seconds. To re-engage the lock, press for 2 seconds. Selecting alternating mode inflates and deflates the cells in sequence over the cycle time selected. An amber light is illuminated. Selecting static mode inflates all cells with no dynamic alternation. Amber light is illuminated. To silence the audible alert, press the alert mute button. An amber indicator is illuminated. For safety, the alert will reactivate every 15 minutes until the fault is diagnosed. Once the fault has been fixed, press the button to reset the alert. An amber indicator flashes and an audible signal sounds if alternation failure occurs. An amber indicator flashes and an audible signal sounds if a power failure occurs. An amber indicator flashes and an audible signal sounds if the pressure becomes unacceptably low during operation. If the control unit is not working, check that it is plugged in and turned on at the mains. Check that the control unit is also switched on. If there is low pressure, check the air connector is fitted correctly into the control unit and is not constricted or kinked. Ensure the CPR dial, located at the foot end of the mattress, is in the closed position.